Hello and welcome to Women Achievers. This is a program that chronicles the woman from girl child to adulthood and to boss lady. And today on the program we have Moji Makanjuola, a veteran journalist, a major expert in the health sector, a philanthropist, a gender advocate. Please welcome Moji Makanjuola. Welcome to the program. Let's hit the ground running. How would you describe your journey?
It has been in several folds, and I always want to say that it has been the grace of God that has allowed me to live through it all.
I know it's a lot. Just give us a summary.
I was a sickly child growing up, and so a lot of things were put into context. Would she survive? Would she live? But I'm one whom I would say that gender equity started with. My father believed in me from day one. He knew, he said I was a survivor, and I lived through that. Yeah, each time knowing that I have his back, and of course my mother. So my journey in life has been a roller coaster. Sometimes the very lows, sometimes the very highs, sometimes, well, swimming on and getting things done. But essentially, for me, it has been the grace and mercy of God.
So let me take you down memory lane. What was it like growing up in Nigeria?
Hey, what was like growing up in Nigeria? I was born in Jos, and I sincerely just hope that I could claim that I'm a Josite. but well, the way the country is, the systems work, I even on my passport and every information about me, I make it proud to say I was born in Jos. That's where it all started. So, and we lived up in the north. My father worked with the railways, so Nigeria was sweet. I mean, listen, we used to travel from Zaria to, to the east, and in the train, and you can imagine, the soups and the hot rice that our mothers, cooked. And at every station, there was a friend, there was a family that would bring food in. And so I learned how to eat every Nigerian food, and even learned how to make them. So Nigeria is the Nigeria I grew up in, which I pray for every day, which breaks my heart because I'm not seeing that Nigeria anymore. The Nigeria where we would, when we are traveling home, when my father was trying to integrate us to Kwara, where we come from originally, we'll leave Zaria midnight so that we can make Ilori in the morning. Yes, and safe. And you had stopovers in Mokwa, in Jeba, where we would buy fish, where my mom will make soup like in 10 minutes as soon as we arrived, in a lorry before we went to Ofa, where, because we would have brought everything, the pepper, everything is ready. I don't know how those women made it, but that was Nigeria I knew. Even before we settled down, people would bring in food, and they really don't have to be your blood relations. I mean, I can make bold to say that every state that I go into in Nigeria today, there's a family. Not a family friend that was made in the last 10, no, family friend that was made as long as I was born. And we don't even consider ourselves as family. As friends, we consider ourselves as family. That's the Nigeria I grew up in. The Nigeria where I danced to Juju Calabar in Mena. Where I did my Hausa and Fulani dance in Kano, where I went to school in Kaduna, and it was, that was where I have my friends from Adamawa, from Port Harcourt, from Bayelsa, where everybody, we never even thought about where do you come from. What was important to us is the fun, the commonality of being ourselves, of being a Nigerian, which I'm not sure still happens.
Let's talk about the schools you went to and what informed your being a journalist.
Okay, I went to several schools because my father, like I said to you, worked in the railways, and they moved, went to primary school in Kano, in Zaria, in Minna. I started actually in Minna, born in Jos, moved, school age, moved to Minna and all that. Well, secondary school in Kaduna, a bit of my upper university at Bayero University, where I did my professional diploma. Then, of course, in the States, somebody, where I finally had the opportunity to have a degree. And of course, well, the IIJ, where I had to do continue with professional training. So you can see that I'm a thorough Nigerian. And when I travel out, maybe making presentations, and people ask me, oh, what university were you in America? I just said, oh my God, this is Nigerian brand, trained in Nigeria for Nigerians and for Africans. Yes. So that's just it. And, and the standards, those days, your teachers were next to God. And I remember that I never liked eating. And my mom would just say, okay, teacher, this is coming. If you don't finish your food, oh my God, even if I have to drink it through, I will have to. So, that was the discipline that I grew up with at home and at school. And of course, the community at large. You were Moji for your parents, but you were Moji Nigeria, if I can use that, because the community owned you. And so you felt a sense of responsibility to be able to be of good moral standing, because the community is watching.
Wow. So when exactly did you cut your broadcasting teeth?
Okay, yes. When did I cut my broadcasting? I've always loved broadcasting. Especially when I was in the secondary school, I was in the debating society. And then we used to, oh my God, we used to listen to radio. I had this little radio. It was given to me as a birthday present when I was in Form 2. So everybody knew me with my red radio, because I would listen to it. And I thought I had always wanted, I loved writing. Okay. I think I'm a born activist. And I saw the media as a tool to use to achieve my dreams. And then we lived in Zaria, and there was at that time, Auntie Teresa Boya. She used to write a column in New Nigeria those days, and I always say, one day my name will come out, Moji Adeyemi then, as as a columnist. So I've always loved things around literary arts. And at 10, my father bought me the complete works of Shakespeare, wow, which I read through. Wow. And so I kept the book, I think I kept the book until, I don't know what happened in the last 5 years. I haven't seen it, but so that for me was the foundation, being a journalist. If I wasn't a journalist, I probably would have read law. Okay. Yeah, but you're still in the literary, something like that. Okay. Maybe just be a writer.
Let's talk about the Nigerian healthcare system. When you became a health journalist, you gave us such insights like we've never had before on television. And you dominated that scene for almost 20 years plus. What's the story? What's our healthcare system like? What's your deductions?
Yes, I would say to you that what prompted it was, yes, when I was at NTA Ilorin, I was made to cover every bit. Okay. But I found out that any bit I covered, to the grace of God, I made an impact. So when I lost my mother, unfortunately, to an accident, where I'm sure that if there was quick health intervention, she probably would have survived it. I just resolved within me that the only way to keep her memory on for all that she did, for all the sacrifices she made for me and my siblings, was to report health. So when I started that in Ilorin, anything about human angle health, I was inclined to report it. So when I was transferred to the headquarters, NTA Network News, one day I kept reporting health and social beat. One day, the editorial board just came on, and the deputy director then, executive director, just said to me that, Moji, you've been given the health and environment desk to cover. Wow. I'm like, okay. I was not quite a senior. I think I was on level 12 when I was made head of health and gender. And that was the journey to my health reporting. I never looked back.
So based on your experience spanning decades, what is your assessment of the Nigerian healthcare system, and what do we need to do to revamp the system, to revamp healthcare in Nigeria?
A lot.
Wow.
And it's not just about government. I've seen revolution in terms of tertiary institutions, being converted to world class, and yet we have such neglect that they're not what they were meant to be. I've walked through the last bit of Ransom Kuti, bless his soul, primary health care, being able to meet the needs and demands of Nigerians. I saw the growth. I saw the downfall, which is also very painful. I've seen human resources. I've been to hospitals around the continent. There's nowhere you go for specialization that you don't see a Nigerian. So why can't we do that at home? I've seen, my God, but I'm very optimistic that things will change. I believe in the present administration. I believe in those that have worked before, whose steps, whose intervention should be carried along. There should be some measure of continuity taken from what has worked before and bringing into what is working now, so that we can revamp the health sector. This should be the African hub for health intervention, because we are the largest black people, and we have our own peculiarity. So I can say that, if you have a disease in your state, you probably won't be, you would want it cured, not the one in other states. So it should be something that we should be doing for ourselves. We have some diseases that are black man disease, that Nigeria should be in the forefront to champion. Is that the elimination, the containment of these diseases? We have things, that are just common to the black race. We have cancers that happen more with black than we have maybe because a variety of things, a variant of things. We shouldn't even be talking of malnutrition. We're so blessed. Nigeria should be the hub, but what I love about what is happening now is that we're not shying away from the fact that mistakes have been made. We're not shying away from the fact that some good or best practices were made before, and we are converging that into what the new coordinating minister of health and social welfare, Mohammed Pate, is doing to the bit. Everybody has a role to play. Yes, we have it bad, but we can make it better using our own efforts, using our own innovation, doing multi-sectoral approach to it. Yes. So, Mayowa, the times are that we can get it right. And I'm happy to say that one is part of it. And it's a collective responsibility. I must say that here. It's a collective responsibility. That woman in your compound who is pregnant, who attends a antenatal clinic, and when it's time for delivery, say she has to go to church or bring a quack home. Now you can just be the health advocate. Say no. You've attended maternity sessions. Why don't you go and deliver at home? Deliver in the hospital. Deliver at the hospital, at the facility. Then she goes and delivers. Complication comes, she will now tell you, oh, I'm lucky to be alive because you asked me to go to the antenatal clinic. You find out that you also have contributed to saving one life. And that one life, you don't know how it will impact on several other lives. So We are not where we should be. The University of Ibadan Teaching Hospital used to be the hub. What happened? We have areas, things are growing now. We have some specialized hospitals coming up. Can we maintain them? Can we sustain them? We have beautiful policies out there. What are we doing with them?
But that brings me to medical tourism. How do we checkmate medical tourism in Nigeria?
How do we checkmate medical tourism? Provide the environment. Make it work. There are a lot of things that needs to work in Nigeria. We must maintain the facilities that we have. We must be able to keep the human resources. Because even if you have a beautiful hospital, you need people to work. Yeah, so if we have the Japa syndrome now, it means because people are not satisfied. Yes, you can't get 100% in terms of facility, but we need to look at our facilities. We need to look at the remuneration that are given to these professionals. We must look at the holistic, if we want them to work at the rural areas, then there must be schools for their children. We cannot revamp our primary health care if we do not have the right people working at it, working at that level. Then the state also must see that they have a responsibility. It's not a federal government thing. The local government now, we hear that, they are going to have financial autonomy, must know that health is an investment. Yeah. Health is a development tool. When your people are healthy, they work better. If you have malaria, for example, now you take about 3 or 4 days out of work, that's an economic loss to wherever you work. So for me, it's an imperative that we start seeing health as a development tool. We cannot pay lip service to health. It's an imperative for life. It's either you're healthy or you are not. There are no two ways to it. So I'm passionate about the fact, and then the private sector too must also take charge. Yes. We're looking at, these days there's the National Health Insurance Agency, where you can pay as low as 30,000 to insure a person for life, for a year. Wow. That person can get treatment. You don't have to go and knock. I'm sure for you, Mayowa, and like it happens to me, there's no day I don't receive at least 50 calls from people. Oh, we have malaria, we can't treat. Oh, the simplest of things we can't afford to treat. But if we have this collective basket that is called the health insurance, then, and even at the local government level, at every level, then it means that when that child comes down with malaria, or when that mother, because take for us women, the child doesn't say to you, okay, get ready for me, I want to be born at 5 p.m. The child comes when it's time for him to come, or him or her to come. Oh, there are programs that we can emulate. In Jigawa State, for example, the transport owners came together and said we would support government in health. So they would give transport for people with health emergency needs. We have all this during the health reforms of with Professor Lambo. We went to every nook and cranny of this country, and people, particularly I dare say, our politicians would say, they will come build you a hospital. If you build a hospital for me that is about 20 or 30 kilometers away from where I live, how do I get there? Where are the people living? Or they do not understand the operations of health. Say, okay, we will provide hospital, and everybody is happy. No, it's not just about the hospital. The facility, the human resources, the pharmacy, what they need, the medications needed, the peculiarity of that place. Did you study it? If for example, they have immunizable diseases, and when you immunize the children, or immunize, the adults, then you lower, the disease spread. What are you doing? How much of it do we understand? What are we thinking about our pharmaceuticals growing? Look at India. Or China. See how they have grown using population and expertise, and we have them. So it's creating the right environment, and I think that's what this new administration is trying to do in the Federal Ministry of Health, and everyone should support that move.
The Chinese The Chinese people have invested a lot in traditional medicine, and it's reporting in their GDP. What can Nigeria do to also raise the bar of traditional medicine in Nigeria?
Yeah, thank you for bringing this up. It's just that maybe we're not giving enough visibility to it, and there are economic gains, serious one. The teas that they bring in, I'm sure we have them.
Yes.
You know, all these things they bring, all the herbs, all the condiments that have become medications now are things that are available in Nigeria, and so some of them have been scientifically proven, you know, to be potent. So for those who are working in that line, let's give them visibility, more visibility, and I think the media has a role to play here. But there are processes, you know, where people will come with and say this can cure everything. No, I won't give visibility to that. But I mean, if it's proven that you have a treatment or a cure for a particular thing, I'm sure that Nigerians would want, so that it will reduce the capital flight to acquire these things, and more than anything else, improve our own basis in terms of sustainability for treatment and cure and containment of some of the diseases that are peculiar to us as blacks.
So let me come to your post-retirement years. You have been building bridges.
Yes, I'm still building bridges. Yes.
Yes, I know your program, Building Bridges. Tell us how far.
The bridge came alive after the UN bomb blast. And the then First Lady of the Federal Republic of Nigeria called me up one Saturday and said, look, let's find something where we can talk to ourselves. And, you know, instead of this mourning and this, Nigeria, obviously, people were not happy. So my late boss, bless his soul, Jimmy Ate, I spoke to him and he said, yes, there's something I have here for you, because I know I was counting down on living, on retiring. And he said, there's something I have here for you, Moji, and I know you, so this is something to live with, because I don't know any other business outside this. I can't sell. So, you know, so that's how in his writing, the content, the dream of Bridges started. So I went back to the First Lady then. I said, ma'am, I have Bridges. She said, Bridges, what is it about? I told her. We had a meeting. And that's how the first episode, the first 13 episodes of Bridges, and we thought it should cover social, economic, political, gender, health, you know, name it. So I started with her and them, and Mr. Ate had the first episode of 13 episodes, which was good, but it didn't, you know, I don't think that people keyed into it at that time. But even when she left office, I said to myself, I need to keep this alive for Jimmy Ate, who believed in me and wrote it out for me. So I continued with Bridges. Oh yeah, we used to have audience. Then we had to stop. Yeah, because audience participation. We had to stop that. COVID came. COVID came, and then we had to reformat. We're still building Bridges. And I thank all of you who have continued to, you know, support us in one way or the other, particularly NTA that gave us, you know, the platform to keep on, to stay on air. But the bridge that I want all of us to build is that bridge of unison, that bridge of peace, that bridge of patriotism, that bridge of I can't do it, I'm a Nigerian, I'll do it positively, that bridge of reputation, that bridge of being a good citizen, of being a community builder, that bridge of Mayowa giving, her space to promoting women, that bridge of participation, that bridge of inclusiveness, knowing that 50-50, we can build a better Nigeria. For me, as long as I live, and as long as God gives me the strength to continue, yes, I will keep building bridges. Even when I'm not on air, I build my bridge.
What advice will you give to a young girl that wants to go into broadcasting?
Hard work. Because people just believe that it's just, to make up and come on television. Mm-mm. It goes beyond that, you know it. Hard work, read, track, trend, let things come to you. I mean, if you choose the field, these days it's good to be a specialty. We see them on foreign television stations and radio stations. Once you see them come out, this is about, his beat. I don't want to mention names, but there's a particular person. Once it comes on, he's going to talk about money or economics. Let your work showcase you. It's not about how best you dress or how best you look. It's about the best that you can bring from here and join it with your beauty, like they would say, beauty and brains. That's what is needed. So it's not enough to go to university. It's the university of self for a profession that you've chosen that will distinguish you from your colleagues. So go for it.
Okay, okay. Thank you very much for coming onto the program.
You're welcome.
Moji Makanjuola with a golden voice.
Thank you so much,
That's
Maya.
Moji Makanjuola, a veteran journalist, a gender advocate. Oh, and I didn't mention her masters of ceremony. She's very good at the craft with a golden voice. We've seen so many of her performances. And she's also a philanthropist. She's a healthcare expert. And she's so many things rolled into one. Like I always say on this program, women are layers of onions. When you start talking to them and you begin to unravel the layers. Till I come your way again next time with an onion lady, a boss lady, a boss of bosses to unravel the mystery behind the woman. My name is Mayowa Oluwabi. Thank you for watching.